That may be partial or complete.
See. So fracture is nothing but it is the break in the continuity of bone. So all the fractures are not the same type. There are different types of fracture you can see. Okay. So anyone can see what are the types of fracture?
Open fracture and closed fracture. Now open fracture is the inside of the body. Fracture the bone is called open fracture, and the fracture bones it will be coming from outside the skin area. The fracture is closed open fracture.
Okay. So if the bone is coming piercing out of your skin, it is called as open, and if the fracture is inside your skin, it is called as closed fracture. And according to the pattern of fracture, it is divided into different classifications. What are the patterns you know in fracture? What are the patterns? So normally there will be simple fracture, and it can be divided into different patterns like spiral, oblique. Any other patterns you know?
Transverse fracture.
Transverse, then
Green stick fracture.
green stick fracture. So what is a green stick fracture? Who will get green stick fracture commonly?
Children's.
Okay, children will have the green stick fracture. But in this fracture, there will not be break. There will be bending of the bone. Okay. So that commonly seen in the kids. Okay. So then what is comminuted fracture? Anyone know what is comminuted?
Comminuted is like a crushed fractures. Parts of bones suspended around the fracture.
Many pieces.
There will be many fragments, many segments will be there. In a simple fracture, there will be only one break in the bone. It will be divided into two equal halves, or there will be two halves. But in comminuted fracture, there will be multiple fragments. Okay. So when you can get a comminuted fracture?
Crush injury.
Crush injury. Mainly when you
Crush injury. Machine
injury, and when there is a road traffic accident and all, you can get a comminuted fracture. Okay. Then what are the other types you know?
Spiral fractures.
Spiral fracture. Then
Transverse fracture.
transverse fracture.
Oblique fracture.
Oblique fracture. Okay.
Segmental fracture.
Segmental. Okay. So based on the location of the fracture, it is again divided into different types. Do you know about that? According to the location, where it can have the fracture. So what are the parts of a long bone? Long bone has three parts, three modern parts. What are the parts?
Epiphysis.
Epiphysis,
Diaphysis.
diaphysis, and
Metaphysis.
metaphysis. And if the fracture is present in the epiphyseal region, we will call it as epiphyseal fracture. If it is in the diaphyseal region, we will call it as diaphyseal. And if there is present in the shaft of the bone, we will call it as metaphyseal fracture. And these are all traumatic fracture. Other than traumatic fracture, what are other fractures you can see? Pathological fracture. What is meant by pathological fracture?
Any pathological condition occur in his body, that time bone will be break. That is called a pathological fractures. For example, osteoporosis condition.
So when there is an underlying cause or underlying disease, that will lead to fracture. Then what is meant by stress fracture? Do you know what is stress fracture, and what are the common stress fracture you can see in the body?
Multiple bodies, in particularly spinous process, gets fractured due to repetitive stress, overload of the body.
So stress fracture is nothing but when there is repetitive strain inside your bone, that will lead to stress fracture. Commonly in your vertebra and over the pelvic region in the females. Okay. Any other infections or complications you can see while you have a fracture? Complication will be more in simple fracture or compound fracture. Compound fracture you can see complication. Okay. So progression will be faster in a simple fracture. If you have a single segment fracture, what happens? The progression of getting into early recovery will be more. But when there is like comminuted fracture and all, what happens? The rehab will take more time because progression will be taking delay. Okay. Then according to the management, what are the things you know? How you will manage the fracture? First you need to do the immobilization. Okay, immobilization. Then you can do traction as well. And after immobilization, you need to do the post-immobilization management. That is the main part of physiotherapy. Okay, early phase physiotherapy, mid stage, then functional physiotherapy. Okay, so these are the small introduction about the fracture. Hope you guys understood.
Yes, ma'am.
Thank you for your cooperation.